Good afternoon, and thank you all for being with us to celebrate the opening of the new MU ENT Hearing and Balance Center. My name is Bob Zitch. I'm chairman of the Department of Otolaryngology, Head and Neck Surgery at the University of Missouri, and with me up here at the podium, who will make a few remarks in a few minutes, is Dr. Matt Page. And Matt is specializes in voice, airway, and swallowing disorders. I see that we have, a pretty large group here, and I'm really pleased to see that all of you are interested enough to kind of come to this opening and this celebration. I see we have, some members of our department, administrative staff and faculty, clinic staff, support staff in the administrative office, and other members of the community, including I'm really pleased that we have the ambassadors of the Chamber of Commerce to be here to kind of help us out with this this opening. Thank you all for being here with us. We really appreciate it.
Thanks for inviting us.
So the first thing I'd like to do is talk a little bit about this Hearing and Balance Center. This project, the concept for this project started about 5 years ago, somewhere thereabouts, and it's been kind of in the planning and development stages since that time. And obviously this year it became a reality. And I really, first of all, I think very important, I need to thank Will Keel and Mr. Mitch Wasden, who's not here right now, but our CEO of the University of Missouri Healthcare, and Matt Levson. I think all three of those folks were really important in kind of moving this thing along. I think Will, at some point, was kind of doing a lot of pushing, but then eventually we got Mr. Wasden involved, and we got things, I think there were a couple of folks pushing along with Will at that point in time. So those gentlemen provided outstanding leadership and insights for the development of this Hearing and Balance Disorder Center, and basically facilitated it, and I thank you all for that. When setting out to create this center years ago, our goal was to streamline the ability for patients to get ENT, hearing and balance diagnostic and rehabilitative services at one location. And I think with this new center, I think we've been able to accomplish that. In the new center, we see a variety of common and complex patients having ENT problems, and are able to offer diagnostic and treatment services to them. We manage patients with disorders such as dizziness, hearing loss, voice disorders, sinus problems, hoarseness, sleep disorders, snoring, and a whole variety of other types of ENT disorders. We don't principally manage the head neck cancer patients or thyroid and parathyroid patients here. That goes on at the Ellis Fischel Cancer Center within among the faculty in our department. But for the most part, we manage those types of disorders. Our primary goal, though, with the Hearing and Balance Disorder Center was to provide specialized expertise that focused on disorders of communication and balance. And I think we're set up to be able to deliver that, and much better than we have been in the past with this center. We have very skilled audiologists, and I hope you have a chance to meet some of them later on this afternoon, that deliver audiology services such as hearing testing, as well as hearing aid and cochlear implant evaluations. Cochlear implants, for those of you who don't know, is a way of restoring hearing for both patients that are essentially deaf. We also have the ability to offer hearing restoration for adults and children through cochlear implants, hearing aids, or surgical procedures, whichever is appropriate for that specific patient. We offer neurotology services and vestibular testing for patients that have balance and dizziness problems. And then we offer very sophisticated laryngology services, which basically involves voice and swallowing type disorders, and that's coordinated for the most part by Dr. Page, who you'll hear from in just a few minutes. So these are very specialized services, not easy to find around the state, but certainly even more difficult to find under one roof, for sure. One of the things you're going to have an opportunity to see in a few minutes are the procedure suites and the exam rooms, which are outfitted, many of them outfitted with high-resolution monitors and cameras, which are useful in allowing the patient to actually see what the physician is seeing when he does an examination, say, of the ear, the eardrum, the ear, middle ear, the voice box, larynx, vocal cords, those types of things. And I think that's really important because it's a whole lot better. I've found over the years in practice, it's a whole lot better when you're trying to tell patients about something they can't see, to be able to show them what you're seeing. These are parts of the body that they just can't get a grasp as to what you're looking at, unlike orthopedics, where you might see a broken arm or whatever, things externally. So this actually helps a tremendous amount with patient understanding and really overall patient satisfaction with their encounter here in the clinic. So we're really happy to have that, and that's been certainly a major improvement in being in this center, to be able to have the ability to show patients and educate patients on the disorder they come to see us with. So with that, I'd like to allow Dr. Matt Page, introduce Dr. Matt Page here, and have him come up and make a few comments about the center as well. Matt played a real important part as we kind of finalized plans and kind of moving towards setting up the layout of the building and the move from our former location into the building. And here's Matt.
Thank you, Dr. Zitch. This new center has been, as Dr. Zitch mentioned, in the making for 4 or 5 years, and it's really about our patients. Here at the MU ENT Hearing and Balance Center, we place a very high priority on educating our patients, and we want them to be able to understand their health when they leave this building. What Dr. Zitch mentioned about the monitors in the room is central to that, so the patient can see what we see and can understand a lot more deeply what's going on with their own body, and I think that gives a lot of reassurance to people and helps them buy into their own health care. We can offer our patients complete ENT care for a range of both common and complex disorders, and I'd like to tell you a little bit about the MU Voice, Swallow, and Airway Center. That's kind of a mini center within the building. Though this center is located here in the new facility, it is really a campus-wide team. Our team includes physicians, specialized nurses, speech-language pathologists, researchers, engineers, and even veterinarians who collaborate in taking care of patients and in developing new treatments and diagnostic tools. We also have singing voice specialists over at the School of Music who help us with patients who have problems with their singing voice. Many of our patients are people whose job depends on their voice, such as salespeople, telephone operators, teachers, preachers, and broadcasters. Another large group of patients have difficulty swallowing, and that's for a wide variety of reasons, mainly neurologic disorders and people who've had head and neck cancers. Some patients may work with a speech-language pathologist to optimize the muscles involved in voicing, and others may be prescribed medicine or advised to have surgery. Now, your voice is an important part of being human. It's an important part of your identity, and your ability to swallow is really important for your nutrition and for your ability to enjoy a meal, either by yourself or with your family and friends. If you have a change in your voice or develop hoarseness that lasts more than 3 weeks, or if it's taking you or a loved one longer than about 30 minutes to finish a meal, you should really talk with your doctor and consider making an appointment with our team. Here at the MU ENT Hearing and Balance Center, we offer state-of-the-art diagnostic and treatment options, including a lab that allows a physician to diagnose and evaluate balance disorders using computerized goggles that track a patient's eye movements. At almost 13,000 square feet, our center gives us the space to meet the needs of our patients in one convenient location. The center includes 3 suites for surgical procedures, 5 general ENT exam rooms, 3 exam rooms for patients with voice and swallowing problems, 5 dedicated rooms for ear exams, 2 rooms for fitting hearing aids, an on-site lab for hearing aid repairs, 2 cochlear implant rooms, a balance testing lab, 4 sound booths, and a treatment room for voice disorders. So, whether you're experiencing dizziness and would like to have your balance tested, or you've noticed some hoarseness in your voice, we're here to take care of you at the MU ENT Hearing and Balance Center. I'd like to now invite the chamber ambassadors to join Dr. Zitch and me for the ribbon cutting.
Yes, please.
Experience life loud and clear. Smile, cut. Hey, perfect.